everyone, and welcome to our podcast. Today, we are discussing the book Springer International Handbooks of Education, Handbook of Using Virtual Exchange Across Disciplines, Building Global Citizens from Home, edited by Kelly Tzoumis and published by Springer Nature. The book is expected to be released in the late spring, April 2026. Yate, hello, greetings from Navajo Nation. I am Dr. Henry Fowler, Associate Professor of Mathematics at Navajo Technical University, based at the Chinle, Arizona campus, Navajo Technical University, whose main campus is in Crown Point, New Mexico, serves the Navajo Nation as a tribal institution dedicated to advancing indigenous education, cultivating innovation, strengthening communities through cultural grounded and transformative learning. Today, I am joined by the authors of the chapter titled Teaching Research Methods in Health Science and Agricultural Economics, Using a Global Collaboration Virtual Exchange between U.S. and East Africa. I would like to invite our co-authors to introduce themselves by sharing their names, titles, and universities. So I welcome AK.
Thank you. My name is Aklilu Zaliki. I am a professor of mathematics and statistics at Michigan State University in the United States.
Hi, I'm Fides Kundi. I'm currently lecturer at the Department of Agriculture and Applied Economics at Lilongwe University of Agriculture and Natural Resources. In short, we abbreviate it as Luana. This is in Lilongwe, capital city of Malawi in the Southern Africa.
Thank you for a wonderful introduction. To begin our conversation, I would like to ask, how did this collaboration come about, and how do you become collaborative partners for this virtual exchange project? AK?
Yeah, thank you. So this collaboration started in 2024 when at Michigan State University, a call was made to start a virtual exchange program between MSU faculty and global faculty from Africa to collaborate on global exchange in learning and teaching. There was a proposal that was made out. It's called COIL Africa Fellowship Program. COIL stands for Collaborative Online International Learning. So I applied for that proposal to start a course on teaching research methods for the health sciences, collaboratively with a colleague from a university in Africa. And then through the African Alliance Partnership, which is a unit at MSU that facilitates this collaboration, I was paired with Dr. Kundi to teach because both our interests in research methods, even though she's in agricultural economics and I'm teaching for the health science students, we had some common theme on research methods. So we were paired to develop a program and see if we can come up with an initiative that will be used to bring our two campuses together globally. That's how our collaborative work started.
Indeed. I think it is like the way Prof. Akriru has explained. That's the pairing happened under the COIL Visual Exchange Fellowship, which I did and applied, and thereabout we really had that exchange between his students and also my students. These were undergraduate students, which we normally supervise from third year to fourth year as partial fulfillment for their degree program, which is a 4-year program. So I had almost, I think under my supervision, I had 6 undergraduate students who were majoring Bachelors of Science in Agricultural Economics. And we had also other 3 students who were majoring Bachelor of Science in Development Economics. So normally they conduct research projects and a specified topic of interest, research topic of interest. So those are the students who interface with their counterparts from Michigan, from where Prof. Zeleki is working.
Thank you for sharing the origin of your collaboration. This partnership was grounded in a shared vision to prepare students for global and interdisciplinary problem solving. Across your response, we hear that this collaboration was built through intentional relationships, mutual respect, recognition that complex challenges in health science and agricultural economics require diverse perspectives. Our first question, based on your chapter, what impact did virtual exchange have on your subject matter of your course? AK?
Yeah. So the virtual exchange platform had tremendous impact on student learning in terms of subject matter. I can state two or three specific areas. For example, our students or my students who are enrolled in this course were primarily interested to go into the medical field, mostly to join medical schools or be in the public health area after graduation. They were all seniors. And they were primarily taught about healthcare policies or practice of medicine, primarily in the United States, and their perspective of how to prevent diseases, how to implement policies to tackle healthcare problems were mostly focused on their experience that were taught based in the US. Now, through our virtual exchange platform, our students and the students from Malawi were exchanging on a regular basis ideas on how healthcare is practiced in Malawi. What are the main challenges there? How is, for example, research, for example, are data collected and how is information about patients is used in Malawi compared to patients' information used and gathered and protected in the US. This kind of global exchanges kind of opened their mind to understand that the basic principles of research methods that are practiced in the US have global nature. And they were really surprised to see that some of the challenges that they have in the US are also present in Africa, but also some of the things that they didn't expect are going to be a problem in Africa were not actually there. So, for instance, things like traditional medicines or traditional or how culture and tradition can shape views and practices in healthcare policies and healthcare practices in Africa can greatly influence healthcare and disease prevention compared to how that plays a role in the US. So this was kind of a big eye-opening for them because in the US we don't see that the influence of culture or the influence of traditional practices in healthcare as much, whereas in Africa it has been through the exchanges they have with their Malawian counterparts. Aside from that, some of the basic principles in terms of how you design surveys, how you conduct questionnaires, how you collect information, they were surprised to see that similar practices are implemented in Africa as well as in the US. And it was a big eye-opening experience for my students.
Yeah, I think so. So yeah, mostly it's what has already been captured by Prof. Zeleke. So even our students, I think, could attest the differences that are there within the global North context. Students in a global North university context compared to them who were based in a global South university country context, and They were motivated to some extent, and they really linked. They had interest in terms of analyzing the link between healthy care accessibility and its influence on the productivity of small-scale farmers, knowing that mostly small-scale farmers are the ones who are involved in the agricultural production, and the health aspect of small-scale farmers, it's crucial for them to survive, because if they are in poor health conditions, it is significantly, affect or influence their productivity and also any innovation in farming enterprises. So the linkage between healthcare and agricultural productivity is not really salient, and it's more pronounced, especially under the smallholder farming setup. And our student had a good picture and overview, though physically they could not maybe have that physical exchange, but I think through their interaction with their counterparts, they had at least an idea of how healthcare accessibility is very critical for day-to-day lives within the developed country context, but also comparing to the poor economic country context, which I'm sure the student had good time to interface and have good exchanges between them. Yeah, and this I think will continue to inspire them, and also maybe to do more research, because obviously healthcare accessibility is linked to agricultural labor burden. The more if they are in poor conditions, obviously the labor productivity on the farms it's affected.
Thank you for those insights. What emerges strongly from our response is that virtual exchange significantly transformed how research methods were taught and experienced. Rather than learning concepts in isolation, students engage with research methods as applied contextual and global relevant practices. We hear that students demonstrated stronger engagement, deeper conceptual understanding, and increased ability to apply methods tools such as research design, data analysis, interpretation across different cultural and social economic contexts. Now we move into question number 2. What might have been missing in your teaching discipline if virtual exchange had not been included? AK?
Yeah, I mean, this was partially answered in the first question. If virtual exchange was not implemented, students would not have had the opportunity to learn about healthcare practices, healthcare policies outside of the United States. They would have just been taught the basic sciences of research design methods, implementing healthcare policies from the perspective of the United States. Whereas healthcare is a global challenge, is a global problem. And as a global problem, it needs global initiatives and efforts to tackle wherever it emerges. And this is more pronounced since we just came out of a pandemic in 2020. And it showed us that global collaboration is immensely needed to tackle challenges that may arise in the future in regard to healthcare. And as was also mentioned, problems that affect healthcare can also have trickling effect in economics and other sectors of the society. And as such, making aware students of these global challenges need global effort. And without such an effort of teaching students research methods through global platforms, teaching platforms, they would have missed this immense opportunity to learn about what other countries are practicing, what other cultures are doing, and hence be able to solve this challenge, this problem that our society faces. So, and I would like to also mention that teaching students using this platform has made them aware that we all live in one world and one society and face similar challenges that require global effort to tackle this problems.
Yeah, it's a general really kind of concern, and I'm sure some of them I think all of them I think graduated, and I'm sure they have a good picture of what is happening around the world, especially surrounding the healthcare systems and management, which I think our countries with minimal budgets with outgrowing health programs, which are more pronounced. It's even worse for the small scale farmers. But I'm sure, as analysts, development economists, and agriculture economists, these things are very pertinent for this generation, also at the era the way we are now, to make sure that they had that good picture of what is happening all around the world without being maybe limited to only focusing the sub-Saharan African region. But now they had an idea of what is happening across the global arena.
Thank you for that reflection. A key takeaway here is that without virtual exchange, an essential dimension of learning would be missing: global context. While the students may still require technical knowledge or research methods, they would lack the opportunity to understand how these methods operate within diverse cultural, economic, and social frameworks. So global care is a global challenge. Global effort and global picture is to tackle health problems globally. Your response highlight that virtual exchange brings depth to learning by fostering intercultural awareness, critical thinking, and collaborative problem solving. Without it, learning risks remaining disconnected from real-world application. Virtual exchange help develop not just competent students, but global aware scholars who are better prepared to address complex challenges in their respective disciplines. Thank you so much for sharing your thought today.
Thank you.
Thank you.